All right, I got 9 o'clock. I'm gonna go ahead and call me in order to start the pledge of allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning.
Morning.
Next is approval of today's agenda.
Motion to approve the agenda.
I will second that.
Moving seconded, any discussion? Okay, now all in favor, say aye.
Aye.
Aye. Motion carries. Now is approval of minutes for 7/16/2025.
Lance, I make a motion to approve the minutes dated July 16th, 2025.
I will second.
It's been moved and seconded, any discussion? Hearing none, all in favor, say aye.
Aye.
Motion carries. Next is approval of claims for payment of 7/23.
Motion to approve the July 23, 2025 claims payment.
I'll second that.
It's been moved and seconded, any discussion? Hearing none, all in favor, say aye.
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 Motion carries. Next is consideration of approved utility permit UT 2025-16 for IRUA.
Lance, I'd make a motion to approve utility permit 2025-16.
I will second it.
It's been moved and seconded. Any discussion?
Yeah, this is directional boring of a 1-inch PVC service line and a 2-inch encasement crossing under V Avenue from the south right of way to the north right of way.
Any other discussion? Obviously, if it's in drainage district, they'll need approval there too. Any other discussion? Hearing none, all in favor, say aye.
Aye.
Motion carries. Next is consideration to approve proposal for outside auditors.
Lance, I would make a motion to approve the proposal from Baker Tilly for outside auditing services.
I will second it. From whom?
Baker Tilly.
It's been moved and seconded. Any discussion?
After going through the proposals, I really respect their experience and their continuity of operations plan that they have.
Any other discussion? Hang on a second. Jolene, did you have any comments on these?
Didn't.
Okay. I'll entertain it, yeah.
Why not the state auditing?
Because right now they're running so far behind that we may not be able to keep up with Iowa code regulations of having an audit performed in a timely manner.
How far behind do you think they're running?
Jolene, what are they running now?
Okay, first of all, the thing about running late is we cannot approve our budget until that is done, until we have our audit from the previous year. And sometimes they have been running into the January's and the February's.
Usually that's because counties aren't responding as quickly as they should.
There's a lot of variables in that.
Any other discussion? Hearing none. All in favor, say aye. Aye. Motion carries. Next is consideration to acknowledge the VA quarterly report.
Motion to acknowledge the receipt of the VA quarterly report.
I will second that.
It's been moved and seconded. Any discussion? Hearing none, all in favor, say aye. Aye. Motion carries. Next is change of statuses. I don't have any, so other business. Amanda, come on up.
Morning, Amanda.
Good morning.
I'm Amanda with Hardin County Public Health. During our community health assessment, our CHAW, it was determined just our county, just like other counties, that we have a great need for community transportation. So this topic has been on my mind, and I've been trying to think of ways that we can help to mitigate this issue with a lot of our community members. One of the things when it comes to public health is health, right? So I want to try to find a way that we can offer transportation at a free or reduced cost to those people who need it for medical reasons. So to help them get to their family doctor for preventative care, help them get to the hospital for lab tests, imaging, other related items. We, in the county, have, people rides that comes into our county. So I've been having conversations with the folks at People Rides. I've reached out to those clinics and medical facilities that would benefit from this. Hands and Family Hospital, McFarland Clinic, Unity Point Clinic, to see if we can't come together to help our community members who need the support. When you look at insurances, Medicaid helps to give back funding for transportation. Medicare does not. Private insurance does not. So if we have somebody in the community who has never driven, has no driver's license, has no family or friends who would be able to take them on a specific date to a specific appointment, what happens? They no show to the appointment, they don't go, they can't afford the $30 round trip for a standard People Rides visit right now. So how can we take kind of that burden off? I've also reached out to organizations like Rotary, the Legion, Lions Club, Kiwanis, to see what can we do. So I just wanted to put this on your guys' radar, that this is something that I'm really trying to figure out for the county, not just one town. Because I think it's important that we have access to medical care.
So People Rights is a great program, don't get me wrong. They've been struggling with the federal money, cutting back. They have to start cutting back. I believe it's 1971, there was a 2080 orchestrated between all the towns, county and Region 6. Iowa Falls is currently giving money to Region 6 for transportation because they feel that they need it there, but none of the other towns want to contribute to that. But, and as Region 6 comes, they want to hit the easy button, just go to the county.
Right.
That's not an easy button. They need to reach out to each city. In most cases, not all cases, but most cases, but I did check on Region 6, how many rural residents are being picked up, and it was 0. And it is the duty of the cities as well as the county, but as the county, when it comes to this portion, I believe it's a rural services issue, not a rubber stamp. Pay everybody's bill.
Absolutely,
Yeah.
absolutely. And when we look at, and that is something I took into consideration because I know that Iowa Falls does provide funding for transportation for their people. If I look at Buckeye or Steamboat Rock, are those towns financially able to put forth even $2,000 for the year? It would be a tightness for them financially. And so, this is something that having that conversation with People Rights, with Region 6, and saying, what can we do outside of Iowa Falls? Because yes, Iowa Falls is a big city within our county. If somebody doesn't live in Iowa Falls, that doesn't mean that we should care less. And so.
It's not the caring less, it's the financial responsibility.
Absolutely, absolutely, and I get that. And at this point, I'm not asking the county for any money. I'm simply just saying, this is what I want to do for the county as a whole through public health. And this is what we're working on, this is what the plan will look like. After talking with them, and I'm sure scheduling rides is not something I would ever want to do. but talking with them, does it make sense to have one specific day and time a week? So, break the county into half. New Providence, Buckeye, New Providence, Hubbard, Buckeye, Owassa, we'll throw them in there, on Wednesday of every week from 9 to 1, this is your range. So now we get the clinics and the hospital and the, all the medical places on board saying, if you have a resident who utilizes people rights and they live in this area, these are the days we have transportation available to them. So they're, people rights isn't going back and forth, picking up and dropping off. And our community members aren't being dropped off at McFarland Clinic at 10 AM and have to sit and wait until 3 PM to be picked up from their 15-minute appointment. So just trying to work with them and see what we can do. The thought was, well, what if we had some volunteers who have a van and can pick people up? Okay, we could absolutely look at that, but then it excludes our handicapped people, those who are in wheelchairs or are unable to transfer alone. The liability on that, personal liability for the person driving in their own vehicle, where does that fall? So the best option was utilizing people rides.
And people rides, their volume is down so low
Yes,
that, we're actually looking at trying to get away from the actual buses that we have and moving to the vans.
Mhm.
And that would also change, I believe, change the licensing that's required to drive these things as well.
Sure. So we're very much in the infancy state. We've had 3 meetings regarding this, just to brainstorm and throw things out. And, is this something that we can look at utilizing grants for? Potentially, because it is going back to the community members. Like I said, it's $30 for a round trip. So if you've got an elderly person who, a diabetic, with cardiac issues, give them all of it, right? Who is on a fixed income. It's gonna be really hard to get them to pay $30 for a ride, plus a $20 copay, plus their medications. So what happens?
Plus the raised
They-
insurance premium.
They don't go to the appointments, they self-medicate, try to do what they can, and we know that that's a snowball effect. They end up in the hospital and now we're worse off. Or utilizing 911 as a ride to the hospital, so.
It used to be churches would step up on some of those things.
Yeah.
Getting people to give rides and stuff. And this isn't a new issue. This has been brought to us over the years. And,
And it's not just our county.
oh no.
It's everywhere.
Mhm.
And unfortunately, it's a lot of the smaller counties that don't have a big city.
Right.
Like Des Moines and Waterloo that have, taxis and dolly rides and other opportunities. We just don't. We don't
Right.
have that.
And if I recall, part of the people rides is in, Marshalltown also, and they have their bus system, their
Mhm.
transit system. And they're competing against the same people.
Mhm.
Yep.
So I don't know if people rides is the answer or if something internally is the answer. I'm not sure what the answer is. I just know they're trying to do the same thing over and over and it's failing. So I do commend you for trying something new.
Yeah.
Thank you. And if we can get this going, then maybe other areas will see that too. I know we have a people rides driver who lives here in Eldora. I don't know.
Sure.
There are discussions that we're having and I'm hoping that we can figure something out.
Would be
So,
good.
Oh, thank you.
Thanks for keeping me in the loop, Amanda.
Yeah.
Appreciate it.
Absolutely, absolutely. Does anybody have any questions?
Here with the business.
I have a bunch of signs up at Bio Falls trying to deter traffic away from our bikers today. And I had one tree go down the middle of the night last night, of course, it's on the red route, so. Yeah,
I pick up on.
yeah, so, yeah, of course, of the, all the roads they could have fallen on, so, yeah, so we're prepared.
Okay.
I just have one more announcement to add on to our last week's announcement for the trail. We were awarded the Vision Iowa Cat Grant for $1 million, so we're adding that to the award last week, so very good news for trail development on our River Edge, so.
Hoping you mentioned that.
So yeah, so let's hope we can go out to bid here soon, maybe this fall, and construction next year, we'll see.
Any other business?
No, sir.
Public comments? Don't know if we have signed, if anybody signed one or not.
I did, of course, have a.
Come on up, Julie.
Excellent idea, Amanda. Good luck. Don't hold your breath. Because of course, we know the people here before us are fully engaged and led by these people who purposely cut Medicaid and, you know, children's cancer research and stuff. So don't hold your breath, but good luck. I hope, against all hope, that you're successful. But anyway, I did come to ask a question because we don't know who's in charge of it. Oh, we do, but that's beside the point. I have a couple of questions for you guys here. Not really rhetorical questions either, but I don't expect an answer in reality. Since you support those people, do you support the destroying, the burning of 500 metric tons of emergency food aid instead of feeding it to 1.5 million starving children? That was like over 1.1 million pounds of food. Just burn it up. Let the kids starve, who cares, huh? Okay, anybody want to raise their hand for supporting that?
Where'd that happen, Julie?
Yeah.
Oh, for God's sake, if you don't know,
I don't.
I'm not
I
gonna
don't
tell
know
you,
either.
because you're not paying attention. Jeez Louise, that's the
Does not
problem.
do it.
Okay,
It was shipped to Dubai and burned there.
Oh, okay.
thank you, thank you. Yeah, it's no secret.
$130,000 to the American people.
Okay.
Okay, okay. Oh, and then there's the alligator Alcatraz. I get in favor of that. You know, the concentration camp down in Florida, where they're putting people kidnapped by ICE. You know, and some MAGA people gleefully looking forward to actually seeing people eaten alive by alligators. Anybody in favor?
I am in favor of detention of people that came into the country illegally, so.
Oh, okay,
You asked for an answer, I gave it to you. Julie.
no, actually, those people were arrested because they were following the law, going to a court. For
So
more
Jacqueline
determination.
Marjorie-
He's not gonna argue with you because you
You asked for,
asking asylum. Asking for asylum.
we have a
is
front
not
door, not a back
Illegal,
door.
okay, but so you're in favor though, okay, good to know.
Yeah,
Um,
I'm in favor of detention of those that came into this country through the back door, not the front door, Julie.
And some of them have been here for 30, 40 years and, part of the community. You know what, I'd rather, never mind. We're gonna move
Sounds
on
good.
because we know I have some of your stuff about that. I screenshot stuff. And then of course. Oh, it's too bad our county attorney isn't here. Because I know he's Mr. Constitution. I was gonna ask him, if he can explain to me. Why, he can sit and watch president, oh, you should change that picture. The president took the flag out of it, so now, flag, who cares? I wanted to ask our county attorney why he thinks it might be okay for them to use the Constitution as toilet paper. Yeah, gotta say that. And we lost $13 billion in lost tourism, just so you know. Thank you.
Thank you. Any other public comments? Hearing none, I can ask for adjournment.
Motion to adjourn.
I'll second that.
It's been moved and seconded. All in favor, say aye.
Aye.
Aye. Motion carries.